I really enjoy my visits to Naples, so thank you very much. My dad will turn 98 this month, and he said I should tell you a joke. So here's his joke. There were three men playing cards, and the one said, I went to my doctor, and he's helping me with my memory. I said, oh, what's he doing? He said, well, number one, I must make associations. And number two, I must take the new medicine. I said, well, what's the name of the new medicine? He said, okay, associations. I see a flower, it's got thorns, it could be red, it could be white, it could be yellow. The other guy said, rose. He said, yes, that's right. Rose, what's the name of my new medicine? All right, so we're going to talk about Alzheimer's disease, and we're going to talk about what I can do now and what's going to happen in the future. So let's start with my disclosures. So I do have a number of grants and a number of multi-center studies, but I thought I would start with a patient. This woman, when we first saw her, she was 71, and she did well. She complained of memory problems, but her mini mental score, which is a sort of a measure of mental status, was 29 or 30, which is normal. But she already knew that she had a memory problem. A few years later, her mini mental had dropped to 27, and then a few years later to 22, and in 2009 it was 16, so she was moderately affected then. And this is her. Do you know what year this is?
What year this is? No, I don't.
2010.
2010.
And could you tell me what month it is?
I can't even do that.
I'll help you. It's March.
March.
Now, isn't that extraordinary? So why? If you understand why, you all can be neurologists and diagnose Alzheimer's disease. So I'm going to teach you. This is your tutorial on to be neurologists. The reason is, it's the anatomy. For those of you who don't know, Alzheimer's doesn't affect the whole brain. It really affects, it does not affect the motor area, it does not affect the auditory area, it does not affect the visual area, it does not affect the cerebellum, it does not affect the basal ganglia. Those are the pathways that have memories of knowing how to do things. So when you guys type, or those of you who type, you don't even know where the letters are, do you? But your brain somehow knows how. Or when you get in your car, you put in your seatbelt, put your key in, you haven't even noticed. You can just do it. And we can teach Alzheimer patients to learn how. We taught Alzheimer patients how to do mirror drawing. That's quite difficult to do. Each time we brought them to the apparatus, they said they've never seen this before. What do you want me to do? Then we'd say, just draw in a mirror in between these lines. And they got better and better. They learned how. But they didn't know what. They didn't know what year this is or what month this is. Those are the areas that are affected. So next time you think of an Alzheimer patient, think of what they can do as well as what they can't do. Then you'll be able to diagnose it. So other degenerative dementias, the group of diseases that affects cognition is called dementia. 70% of those people have Alzheimer's pathology. Many of them have mixed pathology. Then they have Lewy body disease or vascular little strokes. So there are lots of causes, but Alzheimer's disease, the way to recognize it, the common variant of it, is that they have a short-term memory problem of learning what, but they still retain how. They walk around, they converse with you, they have good social graces, they recognize your facial expression. There are lots of things they can do, but there are things they can't do. They get lost driving because they have visuospatial problems, they have word-finding problems, but the big thing is they have short-term memory problem, learning new information, learning what. So now you can diagnose Alzheimer's disease. All right, so the history. Let's look at August Dieter. This is Alzheimer's first patient. How old is she? Look at her face. She's 52. It seems to age you on the outside as well as the inside. It's not just the brain that's necessarily aging, right? He did an autopsy, and he was a very good psychiatrist, so these are his notes. What is your name? He asked her. Auguste, she replied. Last name, Auguste. What's your husband's name? Auguste, I think. How long have you been here? She seemed to be trying to remember. He wrote in his notes. 3 weeks. It was 2 days. And she said, I lost myself. Isn't that a poignant phrase? Such a tragedy that this Alzheimer's disease. And this is in 1907. So more than 100 years ago that Alzheimer described this patient, and then he did an autopsy, and with the new technology of that day, he stained the brain with silver, and he was able to see the amyloid plaques and the neurofibrillary tangles. Already then he had beautiful drawings of the pathology in 1907 already. So we thought this was an early onset disease, and it was only in the late 70s, early 80s that we realized that what we used to call hardening of the arteries turned out to be Alzheimer's disease with the same pathology that this younger woman had, Auguste D. So epidemiology, so if you look at these are the estimated in 2050, there may be as many as 15 million people in this country with Alzheimer's disease. Let me say, never mind the Affordable Care Act, we can't afford not to solve this problem. We can't afford it. This country and all the Westerns, because looking after patients with this amount of care is going to break the bank. So we really need the money to do the research. We need a moon landing effort here to actually attack this problem head on and solve it. I'm pleased to say that for the first time in years, the Congress gave more money for research in Alzheimer's this year. Yay, Congress, for the first time. They've been blocking this for a long time. Grants, R01 grants, which are the premier grants, were only being funded at the 8th centile. Can you imagine only 8% of grants? And these are people who are submitting grants who are pros. They do this for a living. That's what they do. And there was no money. They were not funding many, many grants. So it's going to improve to 17%, which is very reasonable. So this year, for the first time, we have an increase. Very pleased to report that. An interesting thing in the epidemiology is this is a study in Lancet 2013. This is a British study, and it's comparing an old study with a new study. And the new study of how many people have dementia is in orange. And you can see that dementia percentage is going down in England. Isn't that interesting? The percentage of people with dementia. And we've reproduced that, and so in Olmsted County in Rochester, Minnesota, we'd actually reported that as well. Other sites have also found that. The Swedish have also found that. So why is it going down? And the reason we think is because of good treatment of vascular risk factors. We now treat blood pressure and cholesterol and things better than we used to. And so quite a bit of the comorbidities of dementia is vascular related. So prevention is actually, it's a good thing to do.